same thing. Bottom line, he is our leader of our New Orleans public schools. And we're also here with leaders not only representing our public schools, but also will weigh in on what we will be discussing and unveiling this afternoon. So thank you all so much for being here. Now, we're here, one, to discuss our ongoing response to COVID-19, this pandemic, and really bracing ourselves for the holiday season. We know that even the Omicron the variant is very much in the city of New Orleans, and we're wanting to make sure, again, that everyone gets vaccinated, and that means everyone, adults as well as children in our community. Our priority just remains just that. We want to continue to be a safe place to live as well as to visit, and of course prepare ourselves for a great start of a new year and all the events and activities that come to the city of New Orleans and that are absolutely tied to the culture of our city. Now, we're excited that 80% of the adults in Orleans Parish are fully vaccinated. We continue to lead the way, not only in the state, but in our country and, of course, our region. 63% of our total population is fully vaccinated, and again, 71% has received the first dose. I like to always rest in that 80% adults fully vaccinated. Now, as of early November, we know that our young people have been and were deemed eligible to receive the vaccination. Now, we're only 27% of our young people ages 5 through 17 have been fully vaccinated. And we know that we must do better, and we also know that we can do better. Vaccines are critical, and this option was not available a year ago. But we know that it is today, and this is our best defense possible of getting through this pandemic. We want to, again, remain safe during holiday events and as we prepare to bring Mardi Gras back to our city and wanting it to be as safe as possible. Today, we are announcing just a few adjustments to the guidelines that are currently in place. Dr. Avegno is going to give you a real detailed presentation on the data. As you know, we've always followed the data and science as we've responded to this pandemic in our community. Beginning on January 3rd, the vaccine mandate will expand to include children ages 5 to 11. We will require proof of vaccination or a negative test at bars and restaurants and other locations for everyone ages 5 and older. Children ages 5 to 11 will be required to show proof of at least one vaccine dose. Beginning in February, the requirements will then expand to 2 doses. This is, again, being very proactive in our approach ahead of holiday season and before the start of the new year, letting you know what will be expected in Orleans Parish. You will also hear from Superintendent of our schools of Orleans Parish, Dr. Henderson Lewis, who also will have, and they currently have, my full support related to the changes that are coming at the school level. We stand united, as we have demonstrated from the very start, in our commitment to keeping our children protected and making our city the safest place to live as well as visit. The bottom line, again, our people need to be vaccinated. You need to get your booster shots. This is the time. And starting again in January, you must ensure that your children are getting vaccinated. We have no time to waste in this, especially if we want to see our city continue to move forward with activities as well as events that are so much important to all of our residents as well as our visitors across the world. But we know that the time is now. We are also beginning to consider re-implementation of a mask mandate leading up to carnival season. Again, we are starting to re-examine that. That's not something that I'm announcing today. That will begin January 3rd. However, we're beginning to examine that because we want to continue to be on a path of progress, leaning into the start of a new year, as well as making sure that we're doing everything possible to come from underneath this global pandemic. So without further ado, I'm going to ask Dr. Avegno to come forward. She will move us through her presentation. Then we will hear from Dr. Henderson Lewis and from other leaders within our public schools. So with that, Dr. Avegno.
Thank you, Madam Mayor. Thanks, everyone, for allowing me to speak today. It's been a while since we've done a data presentation. I want to start out, as I always do, by reviewing where we've been and our current status. So as you can see, the summer Delta surge was almost as severe as our first wave, but afterwards, thanks to continued mitigation and high vaccination rates, as the mayor pointed out, we enjoyed low case counts, low hospitalizations, and deaths for several months. Unfortunately, with the rise of Omicron, that seems to be changing just in the last few days. And if you can see on the very end of that graph, the sharp line up, average cases have jumped significantly, nearly doubling over the past 2 days. Positivity rates, though still low, are on the rise. Much of this prior to this week, I would say, has been continued Delta, fueled by the surge nationally, but Omicron is here and growing in transmission. Next slide. So I really want to stop and make the point that COVID's severity and the destruction that it's wreaked is not unique to any one city, parish, or region. What you see here is the incidence of deaths per 100,000 residents for the entire state, as well as the city of New Orleans, which is urban, our closest suburban parish, St. Tammany, which is really an ex-urban parish, and a rural parish. By standardizing the number of deaths per population, we can compare apples to apples and just see what the burden has been for all of us. We see that deaths have been high no matter where you live. These rates are incredibly high. And COVID is or will be the leading cause of death for many of our areas, if not all of them, for this year. What's truly remarkable about the toll for Orleans Parish is that 55% of all of our deaths came in the first 3 months, March to June 2020, when we really did not know very much about the pandemic. Since then, compared to other areas, our deaths have been significantly lower. Most of the other deaths that you see in other parishes came this year with Delta. That's thanks to our strong mitigation measures and our high vaccination rates. So your actions as New Orleanians collectively have saved lives, and they continue to do so. So here we compare our vaccination rates. As the mayor mentioned, we exceed the state and national averages for the overall population. For our adults, 80% fully vaccinated adult population is tremendous for New Orleans. And even our boosters. You can see that our pediatric vaccination rate is lower than the other rates. And that's understandable since kids have only been eligible for a few weeks, but it highlights the need to ramp up our efforts. In Delta, full vaccination was tremendously protective against hospitalization and death, and the unvaccinated continue to make up more than 80% of hospitalizations and deaths in Louisiana. There have been no deaths in Louisiana from receiving a vaccine and no severe side effects reported in children. Vaccines are safe, effective, simple, and life-saving. Next slide. We still have pockets of our community more vulnerable to new outbreaks. Oh, there you go. And it's a little hard to see on, I don't know why the green's not coming through. The darker the green areas on these maps, the higher the vaccination rates, over 60% or more. This map looks much, much greener than it did when we started tracking this in early spring, and that's thanks to the efforts of our healthcare partners, our faith community, our community organizations, our health department staff and volunteers, and so many more. 1 year on from vaccines, we have administered hundreds of thousands of doses in the city, and the work continues every day with widespread availability in every corner. So once again, though, we face a new threat. The dramatic rise and dominance of the Omicron variant was not a complete surprise to public health experts, but its ability to reinfect and evade some critical levels of protection should give us all cause for concern. And I want to be clear, we do not yet know how Omicron will likely affect us, but the picture is starting to emerge. So here's what we do know. Cases internationally and now nationally and locally appear to double every 2 to 3 days with this strain. That is an exponential rate of growth that surpasses even Delta, and we all remember how quickly that took over. The CDC reported on December 4th that fewer than 0.5% of all cases in the US were Omicron. A week later, that number was 3% of all cases. So that doesn't sound like a lot, but if you've got a high school junior who's studying for the ACT or SAT and learning exponential math, that means that by New Year's, we expect that Omicron will take over and dominate, just as Delta has done for so long. That is a very, very short period of time. So we've been encouraged that many of the initial Omicron cases in South Africa and elsewhere have been reported as mild. However, that population is very young and relatively healthy. And what we do not know yet is the rate of hospitalizations or deaths, either among the young or an older population. This is going to be one of the major determinants of how severe our experience will be. We expect infections to continue to rise. If they are mild, if they're all mild, then our hospital capacity may be preserved, and that's really the best case scenario. If even a small percentage of individuals end up in the hospital because this virus is spreading so quickly, we could very rapidly find ourselves back in the same position in the summer with no beds available and approaching crisis standards of care. If you're paying attention nationally, there are many other states who are there right now because of Delta, and Omicron is coming. How do the vaccines work against Omicron has really been a focus of study because, again, that's going to determine our experience. So what we believe is that for fully vaccinated individuals, so 2 doses of your Pfizer or Moderna, they're about 70% effective against severe cases. Compare that to a 90% plus effectiveness against severe Delta. So it appears that Omicron's many mutations do affect how well the vaccine works. However, with that 3rd dose, that booster shot, protection goes back up to 90% plus. This is why everyone age 16 and over should get a booster immediately. We have just a few weeks before Omicron predominates, and we need to prepare accordingly. So just as you gather food and batteries and emergency supplies when you see the storm in the Caribbean, you should boost now. Omicron has entered the Gulf, so to speak, so it's time to get ready. Yes. And it doesn't appear that we can count on so-called natural immunity to protect us from Omicron, because what we're seeing is rates of reinfection. So if you had Delta, if you had an earlier variant of the virus, are very, very high. So if you think that because you got infected with Delta, you are safe, you are not, and you are playing Russian roulette with your life again. Next slide. So the next few weeks are critical to understand more about Omicron, but the tools to fight it are the same and easily within our grasp. We must continue and expand our high vaccination rates, particularly for children, to protect the entire community. Boosters for everyone as soon as possible. Remember, the booster, just like the regular vaccine, takes a few weeks for a full effect, so get it now. We want to really encourage everyone to stick to the CDC recommendations and wear a mask in public indoor spaces when you don't know people's vaccination or boosting status. The store, church, parties, gatherings. You know, I have largely not stopped wearing a mask for the last several months. I have still been able to enjoy a lot of holiday get-togethers very safely. Testing. Rapid tests are widely available. Whether it's at the drugstore or various other places, they're easy to use, and our city sites still remain at clinics, at hospitals, at our National Guard centers. Have the whole family do a rapid test before holiday gatherings. That's what my family's doing. They're not 100% perfect, but they are easy and they give everybody a little bit more peace of mind. And we have to preserve our hospital capacity so we do not overwhelm our frontline providers, so we don't halt medical procedures and interventions that protect our overall health, and we don't cause more deaths. If you want your hospital to be there for you when you need it, you must be there for them. Next slide. So with the calendar changing, everybody's thoughts turn to our many large events in the spring, which are critical for our cultural, our economic, and really our psychological health. So what do we know based on the experience of the past 2 years about the safety of these events? It is clear that Carnival 2020, when the virus was circulating unchecked and unknown, caused tremendous outbreak of disease and suffering. At that time, we had no detection methods, no tools, and no guidance to fight back. Things are much different now if we focus on what we know works. So our surveillance from Crew of Boo, which a lot of you I know have asked for, provides some clues. We estimate that the crowds were anywhere from 100 to 150,000 people, and most individuals actually from outside of the parish, which is a pretty good estimate of what a normal carnival parade looks like. At the time of the parade, we had very low cases, low % positivity, and low transmission, with a high vaccination rate, indoor masking, and a vaccine mandate that continues today and provides a strong level of protection. Under those conditions, we did not see a large outbreak after the event, which is exactly what we were hoping to find. But we should be cautiously optimistic about this. This doesn't mean that anything goes. This means that if we have events under these conditions, they will be far less likely to cause the tragedies of 2 years ago. Next slide. So with one eye towards Omicron and another eye towards what we all want for the spring, as the mayor said, I'll just reiterate the timeline for strengthening our community protection. So January 1st, expanding the current one-dose vaccine or negative test mandate to children age 5 to 11. Vaccines are safe and effective for our individual children, and they help to decrease the spread in the community, which is going to be so critical. And our pediatric vaccination rates must catch up to adults. And then February 1st, which is 4 weeks before Mardi Gras Day, full vaccination, a 2-dose series, or a negative test for everyone. Full vaccination provides far more protection than one shot alone, critically important now for Omicron. Boosters are even better, and again, don't let anything delay you getting a booster. Right now, it's not required for the mandate, but again, we'll have to continually reevaluate that. As the mayor said, 2 weeks before Mardi Gras Day, depending on what the conditions are on the ground, we will consider reimposing the indoor mask mandate. A lot of places are doing this in anticipation of large events to stop the transmission leading up to the big events and then protect afterwards. The combination of high vaccination rates plus masking does give the fullest protection against outbreaks when hundreds of thousands of people are going to be coming to the city. If cases, % positivity, hospitalizations, other metrics are low, this step may not be needed. But again, many other cities are doing it, and so we really have to be mindful of the risk and be consistent with best practices. So you see the threats to this timeline, right? Cases are going up really fast. In the 3 days since I started this presentation, I had to amend it twice because they're going up so quickly, likely due to Omicron. If they continue to be very high for several weeks, that's cause for concern, as would hospitalizations starting to surge or very high positivity rates. And so at that point, we really would have to reevaluate our approach to preparation for the spring. We're really excited, and I'm happy to turn it over to them to have the support and leadership of NOLA Public Schools with these guidelines, as they are equally committed to keeping kids and staff safe. So you're going to hear about their complementary efforts in just a second. And I just want to close by saying, you know, just like storms, we've done this before. This is not new. We know how to prepare, how to be strong, how to get through. And the health and well-being of all of us depends on the individual actions we take. So please, if you're not vaccinated, do it now. If you are, get boosted now. Wear your mask, and we can do this. Thank you.
And Dr. Avegno, before you step back, can you just reiterate how the impact on our hospitals,
Yeah,
as well as our public safety team?
yes. You know, all over the country, hospitals are at their breaking point. There is no one to come for help, whether it's an ambulance company, whether it's traveling nurses, they are all somewhere else. The winter is traditionally a very busy time for hospitals because people get the flu and they get pneumonia, and then around the holidays, you know, people drink too much or they get in car accidents. So we're already full. If we get hit with another surge, it will impact everyone. It will delay care, it will disrupt care, it will mean that whether or not you have COVID, you are at higher risk of complications. We can't count on the federal ambulances that have helped us so wonderfully. We can't count on other resources because they're all strained. So I don't know how to say it more plainly. If you know a nurse who works at a hospital or a respiratory therapist, ask them. They'll tell you the same thing.
Thank you, Dr.
Dr. Lewis.
Thank you, Dr. Avegno. And before I begin, I want to just take this opportunity to thank Mayor Cantrell as well as Dr. Avegno for your partnership with NOLA Public Schools from day one as we enter this pandemic. And as we continue to stand together, we are very appreciative of the support. And I just want to say, Mayor, that NOLA Public School, our school community, we stand with you on the things that you have shared today, and we're behind your decision. Because we all know that vaccines are the best tool that we have at our disposal at this time to keep our children in the classroom so that they can learn, so that they can grow with their teachers as well as their friends. That's where they belong, and we are committed to make sure that our students remain in the school building to receive their education every single day. And that's why our schools have all come together to require that all students age 5 and up that they are vaccinated by February 1st. Earlier today, we jointly made a request to the Louisiana Department of Health to add the COVID-19 vaccine to the list of required immunizations for students aged 5 and up. This request also included an exemption option for our families. Since we have made that request earlier today, it has been approved by the Louisiana Department of Health. This information is available on our website at nolapublicschools.com, and our schools will provide more information to our families in the coming days. Being vaccinated is the only tool that we have, or one of the most important tools that we have to keep COVID out of our buildings. But when you are vaccinated, we also can eliminate the quarantines that are needed for our students at this time. Being vaccinated also can end the disruption that we're experiencing for our families when a child is sent home because they have come in close contact with someone with an active COVID case. So what I'm asking today is that we all continue to do our part to return to a normal rhythm in our life so that we can do exactly what Mayor Cantrell has said as we enter 2022 and even approach the Mardi Gras season. If our students are vaccinated and they attend the parades, we know that they're going to remain safe and they're going to be healthy. I am so pleased that today we have 2 of our school leaders with us. You're going to hear from them, but I also must echo on today my gratitude to all of our schools, how they have continued to lead the way when it comes down to testing and also getting our students to be vaccinated. So today we have Kate Mihawk of Crescent City Schools and Sharon Clark of Sophie B. Wright High School. Before I turn it over to Ms. Clark and Ms. Mihawk, I also want to acknowledge one of my team members who continue to lead the effort around emergencies in our district, Tiffany Delco, who is also with us today, and want to also personally thank you for your continual support and leadership during these very difficult times.
Thank you, Dr.
Thank you. Good afternoon to everybody. Today is a great day in the city of New Orleans for all of us. All along, we have appreciated the mayor's commitment and dedication to our school communities, our students, and our parents. We support all the work that you have done to make sure that our students are in school and learning, Mayor Cantrell. As school leaders, many of us have experienced the success of what happens when students and staff members are vaccinated in the school site. Students are able to stay in school and receive direct instruction from teachers in a classroom. We support the citywide, school-wide vaccination requirement.
You know, the jobs of school leaders is, one of them is to keep students safe. And during this COVID pandemic, it's what we talk about and think about all the time. And so when we had the opportunity to have mask mandates and support the mayor and the rest of the city in that, we did that. When we thought about what could we do last summer to keep our kids safe to start the school year, we did mandates for staff, right? So we did that. So 100% of our staff and Sophie B. Wright staff and most staffs in the city are vaccinated. And then this fall, when it became clear that eventually our 5+ kids were going to be eligible for the vaccine, we all got together and we said, what can we do to continue to keep kids safe? And so it was an easy decision for all of us. And with the support of the mayor and the support of Dr. Lewis and support of Dr. Avegno to institute this mandate. And we think this is another thing to continue to keep students safe. We have continued testing, weekly testing, and almost all of our schools are doing weekly vaccination, and that's just going to increase in the school year. So lots of families can get their vaccines in school, and we can keep ourselves safe. We want our students in school, we want them to learn, and we want them to be safe. And that's why we support this.
As a testimony to the vaccinations and how they do keep students in school, as Sophie be right, we have over 100% of our, not over, 100% of our staff members are vaccinated, and over 68% of our students are vaccinated. As a result, we have not had to shut down school, quarantine any cohorts, or we have not had any testing outbreaks. We do have testing weekly as part of the district mandate to make sure that we are tracking the testing. But it has been a successful, and our kids are on their way to being very productive citizens this school year.
I told Miss Clark if she was going to brag, I was going to brag. I run K-8s, and so we haven't had as much time as Miss Clark to get our kids vaccinated, but we've been pushing really hard at Harriet Tubman, and we're already at 50%, and so we're really looking forward to that number getting to be the city average soon. So yes, thank you so much for your support. Thank you so much for your support, and we look forward to the new year with our students.
Thank you all so much. All right, so you've heard from me, you've heard from Dr. Avegno, you've heard from Dr. Lewis and our school leaders who are with our children every single day. Thank you so much for all that you all have done to protect our young people and what you're willing to do on the front line. So with that, Ms. Leslie.
With the recent COVID outbreaks at our universities here in New Orleans, Tulane, Loyola, Xavier, can you kind of comment on, what's going on there?
Well, what's going on there is what you just stated. There's been outbreaks of Omicron, of that variant. A large part is the massive testing that our school communities are doing. Both Tulane, Xavier, as you mentioned, but they're using equipment that's really second to none in the country. And they continue to be real partners in combating COVID-19. And it's their embracing guidelines as well as strategies that are not only with testing, but also as it relates to even releasing students a little bit early. But they remain partners in doing the right thing as we see it happening on the ground. Dr. Avegno, anything you want to add to that?
Yes, ma'am. Colleges all over the country are seeing the exact same thing. We are, as the mayor said, we are really fortunate that our universities, when kids came back from Thanksgiving break, did proactive testing, and so they were able to find it and detect Omicron far faster than a lot of other places. So this is not unique to New Orleans. You can't fight what you don't know, and so knowing this early really helped all of us galvanize what needed to be done. So we're very grateful to the universities, and fortunately, so far, those cases have been mild, and we hope that they will continue to be.
This question is for Dr. Lewis. When you talk about your February 1st deadline, is that 2 shots for students, or is it 1? And also, will there be anything happening in terms of clinics at schools in order to get kids shots?
So February 1st is 2 shots, so completely vaccinated. And as well as you've already heard from our school leaders who's talked about the number of events that they've had, the things that they will continue to do. And as we move forward with this mandate, our schools will continue to work with their families to have these events on their campuses.
And the city of New Orleans will continue to be a partner with our school system and schools across the city, no doubt about it.
I'm just wondering if there's any early data on how Omicron might affect children or the vaccine, or whether, them having more recently gotten the vaccine is a similar perception as getting a booster.
That is a good question that I have asked, and we don't know the answer to that. We don't know that if you're a 10-year-old and you just got your second shot, if your immunity is really high from that recent administration, and that's, as good or almost as good as getting a booster. Obviously, kids can't get a booster yet. The most we know about Omicron is in young people, meaning adolescents 18 to 30, because South Africa is a very large population and they've been doing lots of surveillance. Just like 18 to 30-year-olds here, most of the cases have been mild, not all. There's mixed data, quite frankly, coming out about young children from South Africa. There are reports that indicate that maybe they're being hospitalized at higher rates for reasons that aren't clear. And then there are other reports saying, no, maybe they were hospitalized, they weren't quite that sick. So I wish I had the answer to that. And that's something that we're just looking every day to see what we can glean from both South Africa. And now as it's taken over Europe, we'll start to get more information there.
Given the information we know right now, do we expect that children will eventually need a booster as well? These kids bad enough?
I think what you are starting to see, and this is far from being set in stone, is that instead of needing a booster, this will be a full series. So if you think of your kids' shots, the MMWR or the MMR, measles, mumps, rubella, that's 3 doses, right? That's been around, that there are many, many years that establish the efficacy of 3 doses rather than 2. So a lot of public health experts think that this is going to be a 3-dose series rather than just 2. But we're in the middle of it, and so we don't quite know that yet.
With carnival season coming up, can you kind of talk about the updates on Mardi Gras routes and whether those will change and whether dates will change, specifically with Cruise, the Zoo, and Chewbacca's parades that are some of the earlier ones that you've heard?
Right, so as it relates to Mardi Gras, I will be having a press conference on next week, and we'll keep it right there.